In conclusion, Jeff, what are some take-home messages for those neurologists who are treating relapses in MS?
So basically, the take-home message is be particular. Don't accept an incomplete response. If a patient is put on high-dose oral or high-dose intravenous steroid medications and they don't make a very good response to that, or if they have significant side effects that they have to come off of it early, then please bring the patient back into the office quickly, within 7 or 10 days, or even do it to a telemedicine visit. We'll talk about that in a second, and reevaluate them, and then give some very serious thought about, one of these 3 other options that we spoke about, which was repository corticotropin injection, which is better known as the brand name of ACTHAR, the plasma exchange treatments, or even IVIG. I think that's incredibly important. I think it's very important for patients. I tell my patients, you need to be a very big advocate for yourself, not only in the relapse situation, but in MS in general. But you need to be a big advocate for yourself. You need to try to force your doctor to get to what we call NEDA, no evidence of disease activity. And also make sure that your physician is not accepting of an incomplete response to relapses. And I always tell my patients, I said, you have a responsibility in this illness too. This is an illness that's changing on a daily, weekly basis. You need to keep up with the MS Society websites or some of the other good, MSAA websites or other websites regarding multiple sclerosis, so that you keep up to date yourself, and so that you are a good advocate. And I tell this to the patient's family members also, that please keep up on this. Please be learned of the different therapies, and even if you have to, I even tell my patients all the time, please, it does not hurt my feeling if you want to get a second opinion. I know some great doctors. I know a really good one in Naples, Florida, Dr. Baker, or somebody, I say that to them. I say, when I get to a situation with my patients where I'm not exactly sure what to do, we have to have the humility to ask for help. And I say to my patients, you need to be advocates and say, have you talked this over with anybody else? Or do you feel like this is the best that I can do?
How often do you find patients, do they really understand what a relapse is and how to define it? Even despite your best efforts at educating, you go and you give these patient programs and you talk with patients and care partners, and you're hammering home the definition of a relapse. How often do you find that it's a hard concept for them to grasp? So they're underreporting their relapse, or they're afraid to tell you because they're afraid of or they have concerns over the side effects of therapy. How often do you encounter those situations?
I definitely have encountered those situations early on when I start taking care of my patients. But I'm very blessed because I have all my nurses are MS certified. My nurse practitioners and PAs are MS certified, and I always tell my patients, please call or use. We have a web-based program where they can send a message in, and I always say, let us decide what is concerning you and what isn't concerning. I think that's so important. But I definitely have had patients come into the office and they have new onset of weakness or coordination issues, and I said, when did this start? And they go, oh, it was about 2 or 3 months ago. I didn't really think it was that big of a deal. And I'm like, I really need to hammer that home. And another thing is we really need to talk to the caretakers, because we know, as we know, a significant number of our MS patients have cognitive impairment. And so sometimes they will not be able to grasp the importance of these changes. And even such as a simple thing as cognitive impairment itself can be a symptom of a relapse. Yeah. And so again, that definitely that education part of it is huge and very important for our future, since we're developing such good treatments, not only on the disease modifying therapy end, but now we're developing better treatments for the acute treatment of the relapses. Patients, as I said, need to have high expectations.
Mm-hmm. Wonderful. Well, this has been extremely informative. Thank you, Dr. Kaplan, for this insightful discussion. And thank you to our audience for watching this Neurology Live presentation on the expert perspectives, contemporary data on treating multiple sclerosis exacerbations. We hope you found this peers and perspectives discussion to be useful and informative.
Thank you so much, Matt.
Thank you.